Okay, so I always get asked, in regards to facelift, when is it too young? And it really depends on the genetics of the patients and how their skin's been treated. But usually you can do something that even starts in the 40s. And we have all types of minimally invasive lifts. We have a lot of radio frequency that can help with the neck. We also have something called Renuvion that can help tighten the neck and the skin. That is another procedure that doesn't really involve a facelift. But when it comes to extra skin, there are different types of lifts and the neck that we have to deal with. And whether it's something that's called a short scar facelift or a full facelift that involves the middle part of the face, the lower face, and the neck. And these are all types of what we call deep plane facelifts. There are many different types of facelifts. So what I'm going to do is just show you some befores and afters, explain where the incisions are and what type of lift it was and where the primary lift was focused. And we're going to show you some different ages from the 40s and 50s to 60s. So this is a patient in her 40s who actually had a brow lift and also a lower face lift. And you can still see the biggest reason I want to show this is that she still looks the same. Her lips aren't pulled apart or there's no abnormal joker or surprise look, and she still looks very natural. But here's where the big difference is. So she had a short scar facelift, which I'll show you, but here she is with the neck. And this is the area of her concern, the marionette lines in the nasolabial fold, and also this area here. So here she is. You can see the difference. The neck is a lot better. We also did some deep neck work to make this a lot smoother and tighter. And the incision starts up here and heals beautifully around that area. And in front of the ear, and then the short scar for her means it went back behind the ear and just a little bit right there. It didn't go all the way down the back of her hair, and then we'll show you the next one. Here's this view. Again, we're looking at the marionette line, how it's improved. The nasolabial fold, or the nose to mouth lines, are improved. And if you look at the jaw line and the neck, it's improved. We also just did a little bit of fat grafting in the cheek to give her a little bit more volume. So this is, again, someone in their 40s. We call this a short scar lift. Just the difference in the eyebrow with a brow lift, endoscopic, just elevating her eyebrows only. This patient, she came in for eye rejuvenation. She already had big, beautiful cheeks and lower face. And here she is following a brow lift, upper eyelid lift, what we call fat repositioning and a little bit of fat in this area. And then, of course, a full lift, a deep plane facelift. And here she is. You can see now what we're seeing is an improvement of the neckline. And you can see a line along the jaw. You can see how it's more defined. And then the incision starts up in here and around the ear. You can see how well it healed. Here's the 3/4 view. We can look at the eyes. And again, look. Still looks very natural, but you can see we have a better neckline here. Now, this is more extreme. This is someone, she also had a laser, so she's a little red. You can see the difference in the neckline and jawline. It's about 3 months after surgery. She also had some mid-face and eye work and a lower eyelid fat repositioning and a little bit of fat grafting to this part of the cheek right here.